So, hi Dino. Thanks for joining me for this conversation. Do you just want to just introduce yourself and tell me a little bit about yourself?
Well, I'm Dino Esposito. I've been writing books on software for over 20 years now, books, articles, and whatever, mostly under the roof of Microsoft, Microsoft Press in particular. It's been a few years now that I'm active in the area of artificial intelligence, machine learning, data in general, and in particular in a special kind of industry, which is renewable energy. So the company I'm doing most of my work for now as a digital strategist is active in the area of monitoring power plants. Another segment of the industry that I know very well is professional sports. But I've been doing just, having to do a lot with the data and with smart, intelligent software, hopefully intelligent software applications for over 20 years now.
Great, super. And you're currently in Rome, which is it's not the main city to be affected by coronavirus, but it's still got quite a number of cases, right? So how's it been living in the middle of the sort of Italian epidemic?
But honestly, in the Rome area, as well as in half the south, the center south part of the country, the situation is not that bad. So we've been locked down entirely. The whole country is locked down now for 3 weeks. Mostly, let me say, that has a measure of prevention, just to avoid things really going worse. But the real tragedy in this country is in the north, in the Milan area. That is really, really tragic. I was just collecting a few numbers over the weekend. Well, the region where Milan is based, so which is the most productive part of the country, that only region, so one of 21 regions we have in Italy, that one alone has more than infections than the whole France.
Wow.
Just to get, okay, and it's only 36% of the infections in Italy. So we have a 35% there remaining in the rest of Italy, but it's the rest of Italy is scattered through the whole territory. So it's not that dense as much as it is in the Milan area. That is a really, really, really dramatic situation. The rest of Italy is pretty much, being quarantined, experiencing a few days, well, a few weeks in the end. Of lockdown, but not too bad compared to other parts of the country.
And how's life been?
Well, life is still life. You still call life. Personally, for me, is not much different because I'm still allowed to work around because my office is is close to the place, to my house, so I'm allowed to work out in and out every day. So for me, it's regular business day. What I'm missing is whatever everybody else is missing. So going out with friends, meeting people, doing sports, that is prohibited for obvious reasons. That's the part of life that you miss the most. But personally, for me, it's not much different from a regular business days when I'm home. And that's the part that is different because I used to travel a lot. So I'm not used to stay home all that time.
Yeah, I think that's the biggest adjustment for a lot of us who are used to traveling around for business. And we're having to respond in different ways, and technology has been a massive part of that. And I imagine that you've used all the available technology to help you carry on with work. How's it been?
Well, technology is helpful because for us being in the software industry, it's nothing new. I mean, we're so used to do a conf call, to the video calls, to exchange files, to work on public shared repositories. It's not much different. The part that I'm missing most in my life at the moment is just the physical part of traveling. So going in the airports, I mean, maybe it's just me, but that part of life is something that, that it's sensitive. You feel the difference.
Yes.
You feel the difference. Yeah. It's not the business. It's not the business to be different. It's life to be different. Okay.
Well, I mean, one of the things that's happened quite quickly is that they've shut down all of the airports, and predominantly across the world. Governments on the whole have responded in different ways. Now, it's too early for us to make any judgments on which ways are the right ways to respond. But what thoughts have you got on how different governments have responded? Have you seen anything in the data that suggests one route is better than another?
I'm tempted to say that it's the lesson that everyone wants to learn on its own skin. In this particular case, we had the virus coming from a remote geographical point. Oh, it's China, it's the Far East, we live in the West, we're so happy, it will never touch us. You know how many times the recent story, it's over 10 years ago, with the SARS virus. It was dangerous, it was killing people, but it was far, far away from us. So we developed, in a way, the idea that this never happened to us. It's never something that can touch us in the protected part of the world that is Europe. Then this thing came all of a sudden, and we realized, the governments realized, oh shit, this is gonna hit us as well. So we were not protected anymore. So there was a shock for everyone, for normal people and for governments as well. Now, weeks later or months later, we say, oh, if only we did what South Korea put into place. The next day, they found the first positive to the virus. But South Korea was the epicenter of the SARS virus, or was very close to it over 10 years ago. So they knew, they already learned on their own skin what it could mean to be hit by a virus.
Yes.
So it's so easy to say, okay, if only we did that 3 months ago, 2 months ago. What we see is that all governments at different paces, Italy, Spain, Germany, France, UK, United States, even Russia, they are reacting rather than being proactive towards the virus. If there's a lesson to learn, this is the point, in my opinion. We should learn next time to be proactive and not to take, neglect every warning we may receive in the future. Just not because I want to break the sentiment of positivity that is slowly growing up in Italy, at least these days, that the peak is near, so we could expect to be close to the exit of this tunnel in maybe a month from now. But epidemics, and even more pandemics, they are known, sadly known, to have a second peak, at least a second peak. And nobody has the faintest idea at the moment whether this will be the case and how it will be the case. How it will happen. We don't know. We just don't know. No. And this is the real. So I hope that the lesson we are learning, the governments are learning right now, will be helpful, will be put into practice if ever the second peak will come.
Yeah. So it sounds to me like governments who haven't experienced this kind of thing before have become quite reactive. I remember this talk that it was a TED talk, I think, that Bill Gates gave, warning of an impending epidemic / pandemic. And those words are now coming true. Now, a lot of people out there have always said it's going to come at some point. If you look at history through the millennia, you see it spotted by many of these kind of events. So it was going to happen at some point. The question is how the governments really responded proactively outside of these areas that have had more recent outbreaks. We've just got no sort of in living memory any kind of context for that, have we? So perhaps we were naive, perhaps we weren't prepared, even though the warnings were out there.
If I think as the reaction, in front of these things that threaten us to live overnight in a different world. This brings me back to mind the words I've read a few years ago in a book full of giants, the first volume of the Ken Follett's Century Trilogy, in which the author presents, from the perspective of normal people characterized in the book, the beginning of the First World War. And so people were presented and was told by the governments to have to go through this sacrifice of just a few weeks, after which life would be back, and each country involved would have been successful over the enemy they identified at the moment. Instead, we know the story. It took 6 years and over 30 million victims, not to count civilians and casualties. So it could be over 50, 60 million people who died after the war. But in the beginning, it was like, oh, it's just a few weeks, so let's lock down everything for 2 weeks, and then we'll be stronger than ever after that. I'm afraid it's not going to be like this. It's going to be a kind of a logarithmic rise after we reach the peak and we go down the slope of the curve of the infection.
So I think that's a good point. I think what one of those things that we have to get to come to terms with is the fact that this may not be short-lived, that there may be a protracted effort to deal with this, of which we can't for now understand exactly what that looks like.
Nobody knows that. The only thing that we know is it will be different. So the life we had the day before the lockdown, that life will never come back.
No.
It will be different, maybe better. It will be different, and it not exactly tomorrow or the next week.
Sure. And talking on that a little bit more, I mean, you mentioned about data, you mentioned about the machine learning and AI. So what do you think in terms of the way that we've responded to this from the use of data? I mean, if you're over the internet, you can see all the graphs and you can see how much governments are trying to use the data that they have to help the effort. But from your perspective, what part is machine learning and AI how can that be used with all this data to help the effort?
No, the point is that we don't have data. That's the painful point. Epidemics in general, have a long record of models that scientists over the centuries have developed. And these models, statistical models for the most part, have been built using the records and the data captured in some way from events that happened sometimes years or decades or centuries ago. But for COVID-19, it's not the case. It's new, completely new. We don't have any sort of data. The only case study where I define a case study, a situation that reached the peak and then is slowing down significantly, is China. But it was in the news in the past few days. Who really knows exactly how we went there? Sure. We received a few numbers. Those numbers are not consistent with what we're seeing in Spain and Italy and in kind of Germany as well. We don't know about the UK. We don't know about the United States. We don't know if the numbers we've got from China are real numbers that present the correct snapshot of what really happened. So we don't have data. So what we are doing, regardless of what the developers, machine learning, data science, whatever they're trying to do, but what people in the health organizations in each country are doing is they are taking the classic curve of an epidemic, the Gaussian bell, variations of that, and they are trying to fit the uphill of the Gaussian bell with the numbers they observe coming every day from the real world. And they try to best fit the left part of the curve and then see what happens in the second half of the curve. in the beginning, having few data available, the curve and the confidence range is so huge that it makes no sense to look at that. But we've seen in Italy right now, just these days, that now the curve is going to be, realistic, is going to be reliable, and based on that, pretty much everyone agrees that in Italy we're gonna see the peak coming towards the end of this week.
Right.
There's a range 4th to 7th of April, and then 3 weeks for the number of infections to significantly slow down, to be nearly, if not zero, but probably to be reduced to only a few hundreds of cases. And another point that we have learned is that it makes no sense to look at numbers for the entire country.
Sure.
Not even for the regions, for the 10, 20 regions that at each country is split. Ideally, you should look at local hotspots, local, the range, the coverage, the part of population that each hospital covers locally. But even at least at the regional level, it makes more sense that at the national level. And what we're getting from, at least in Italy, but I guess it's pretty much the same in other countries, every day from the civil protection, whatever it is, the organization that takes care of assisting people, we're getting numbers that, to me, seem they have been taught for press and for media.
Right.
Not for scientists, not for techies, not for making any sort of intelligent form of an automatic form of learning. We don't have the data. And I think we don't have data that is dense enough and is accurate enough. I wrote an article, unfortunately is in Italian, just a few days ago, just to explaining what it means in general terms, a data strategy. So as a company, if you want to arrange a number of processes to collect the data that makes sense for your business, there are a number of patterns to follow. None of those patterns are followed if you look at the data you get from national organizations sharing data. Data is in the hospitals, but it doesn't flow easily and quickly from the hospitals to a central repository and then is made public through open data or whatever it is. This is why this doesn't happen.
Yeah.
Digital transformation? Maybe digital transformation, what we call, our mouths are so full of these words, digital transformation. Well, and then in the reality, we don't see data flowing. It should be natural. Data is generated the moment in which a doctor pushes a button to accept or dismiss a patient. That data should flow through all the systems down to the final destination. It doesn't happen. Why? Yeah, digital transformation. This is the second lesson, poor data and lack of digital transformation that the virus is making evident for everyone.
So following on from what you're saying, it sounds to me like some of the problems are, being able to access that raw data. For example, we don't know the number of people who aren't showing symptoms but are infected, right? Those kind of mechanisms to capture that information require mass testing, which isn't available, of people who across the world, across a whole nation, just impossible to do logistically. But if you were able to, then you could see the magnitude of it. So these
Absolutely.
are the logistical challenges, right? We can't get that data because it's logistically impossible. But if there were advances in technology that could allow for data input through, the number of people on their phones reporting if they have a fever, for example. I know I've heard of apps out there that are being used to record if you have a fever or if you have a cough starting. And then that can start to help, but it certainly doesn't cover those that are non-symptomatic.
Yeah, but the work they have done in Singapore, the app called Trace Together, that's ingenious. I mean, it's obviously, it's simple, ingeniously simple and effective. It takes the same pattern of meeting apps. So uses a Bluetooth technology to trace people as they running the same app on their phone.
Yeah.
They are close to a distance. They happen to be at a distance inferior to a number of meters. And then the records are stored individually, separately on each phone, so there is no privacy concerns at all.
Yeah.
And when one tags its own app, hey, look, I've been found positive, everyone that has been in the range is automatically has an alarm raised in the phone. But put another way, the moment in which you who are running this app are found positive, it could be the same health system to force you to upload from the phone to the hospital the list of people that have been near you in the past 10 to 14, whatever, a number of days. But it doesn't take that much to do this.
No, it doesn't.
And yet, at least in Italy, we are observing there is a common bid with all the country invited to participate into the bid, hundreds and thousands of proposals to be one-to-one investigated, and then to give the commitment to bid, and the virus is back to the second peak. So we will be ready for the second peak of the virus.
Yeah. And that's what you need. You need that that creativity, innovation. You know, obviously, yes, it's slightly reactive because we weren't prepared, but it's still very important, right? In the process that we react and we be innovative as quickly as we can, just like they did in Singapore, which helps the effort, right? So it is a call, isn't it, to all those creative in the tech industry to contribute.
Yeah, but another point is, yeah, you mentioned that earlier, mass tests. We've seen in the news on TV from Korea, people driving through the traffic and being at the stoplights, being tested quickly, okay, against the virus. So the availability of quick diagnosis tests, that is crucial. Yes. And I was just reading an article last night from The Guardian regarding the US situation, and apparently, as the article was mentioning, President Trump received in late January an internal note saying you have to, to summon companies and take them to create some sort of some sort of patent, whatever, for quick testing of looking at fever, whatever. In Korea, they did so, and this combined to tracing apps are probably the best weapons we have to seriously fight the virus, because the virus is per se is easy to defeat. You have just to take the first first cases and isolate them. Period. I mean, saying that you close borders, you close people in the houses, it looks like, the solution after the damage has been done. Yeah. I mean, there are measures that at some point are the only things as a government you can do. So I'm not blaming the governments for doing so. And I'm happy to give my contribution to, okay, I'm staying home, okay, as much as I'm told to do, and that's, I want to be a good citizen. But I'm not really sure that my sacrifice really helps them that much. My sacrifice would have been not probably necessary if only earlier the government took the right measures. But at the same time, I realized that, what I was saying earlier, so this kind of thing happened over us, and no one had the anticorps, the cultural anticorps, to believe, okay, we are in Europe, but we are not completely shielded from any virus that can come from anywhere.
I mean, if you're the other aspect is, how long are you infectious before you show symptoms? And in a world where people are moving around all the time, when something spreads, you can't close down quick enough. Exactly. Especially if it's a long period. They're talking about, between 0 and I think it was 14 days potentially, between 1 and 14 days before the symptoms can show. Probably more like 5 to 14. But it's interesting, isn't it? Because if you've got people who are moving around the globe who are not showing symptoms, it's almost impossible to be able to stop the spread.
Yeah, no, in Italy, it's pretty popular, the topic of what is the real physical state of people who apparently is doing fine. So me, I'm fine. I'm completely fine. I've been fine for the past 3 months.
Yeah.
No flu, no cough, no fever, nothing. Yet, if I run a test, a COVID test, I could be found positive.
Yeah.
And it means that if I'm positive, I'm potentially infectious.
Yeah.
I could infect everyone I see. Okay, now the lockdown. So the only people I could infect is my kids, my wife.
Yeah.
The people in the 3 other people in my family. Because when I go out, the social distancing, so there's really no chance I could infect anybody else.
Yeah, sure.
But yet I'm prisoned, I'm jailed in my house like everyone else in the country for what? So the availability of quick and mass tests could at least separate people who are negative from people who are at some point positive. And at that point, it's really a matter of closing down these people for 2 weeks. That's it, only 2 weeks. Yeah. And then it's done. After the 15th day, they're fine.
Yeah, yeah. Because they talk about immunity, they talk about post-infectious immunity could be up to a year. So, that certainly buys some time, doesn't it? And then by then you're talking about vaccines coming in. So, yeah.
Not every type of virus is affected by the immunity, the general immunity. That would be the best barrier, structural barrier. But there is no demonstration, no scientific proof that COVID will be subject to the rule of general immunity after a number of cases. So there are counterexamples of viruses. Okay, we are the virus, whatever. Okay, fine. That are just not affected by this rule.
Yeah, so, understood. So, so Dino, what other lessons do you think we can learn from the situation? I know you've talked and thought about it a lot. You've researched a lot. What other things do you think we can glean from this?
I think that probably there are 3 main lessons. One is digital transformation that I mentioned already. We can't do without it, and every country should take the commitment to seriously implement it. Every single company, tech companies, for the most part, have digital transformation already reality in their own organization. But every single country, every single organization, in the process, before then in practical solutions and practical systems and software, in the process, in the ability of thinking new processes that are compliant with the digital world. I'll give you a stupid example. In Italy, we have definitely a paper-based mindset as a country, and we have a gigantic and particularly stupid bureaucracy. Bureaucracy is stupid all over the place. Every country has bureaucracy, but trust me, in Italy, we are beyond imagination. But so this bureaucracy created the monster of a self-signed piece of paper that we are, as citizens, expected to carry with us whenever we go out. So you go to the drugstore, you go to buy groceries, you are expected to prove your intention with this piece of paper to every policeman that should happen to stop you. Okay, it's a piece of paper. And no matter that they change the template every 3 days, but you are expected to download, manually fill out the form, and then print it out and carry with you. But then toners are ended. Not everyone has a printer at home, so why not an app? A few people contributed an app, but then the postal police warned them to further distribute the app because it was not compliant with some sort of stupid rules they are thinking of. So thinking the process. Okay, you want to track people and you want to people carry an evidence, that's fine. But make it simple. Make it simple. Use an app or whatever solution that makes it easy. So digital, think your process so that they are compliant with the digital world. Number 1. Number 2, the health system. Everyone in every country in Europe, we complain about how healthcare is bad here, is bad there, it is horrible in Italy, is horrible in Germany. Everyone complains about the healthcare, but it's public. And this is the best asset we have, and we should, government and people, contribute to keep this running further in the future. Number three, technical software IT point, simple solutions that work instead of gigantic projects that never start, never work, and invest on science and education, because that's the only barrier that could protect us from whatever could happen in the future.
Yeah. Those are all really good points. Well, Dino, thank you so much for the conversation. It's been
thank you for inviting me.
Yeah, you're welcome. Thank you so much.